You wake up, and before you even open your eyes, you already know something is off. Your mouth feels like you are sleeping in a desert. Your tongue is thick and dry against the roof of your mouth. Your lips are cracked. Your throat is parched. You reach for water on the nightstand, and you drain the whole glass in one go, and it barely touches it. And then you get up. You brush your teeth. You make your coffee, and you forget about it. Because this happens all the time. It happened yesterday. It will probably happen tomorrow. Here is what nobody tells you. That dry mouth you dismiss every single morning, it is not just dryness. For millions of adults over 50, it is the body's earliest, quietest warning that something is going wrong underneath the surface. Something that, if left unchecked, can lead to outcomes that no one wants to name out loud. Today, I am going to name them. And I am going to show you exactly what your body is trying to say and what you can do about it, starting tonight. My name is Dr. Adriana Markson. If you are over 50, this video is for you. If someone you love is over 50, stay with me because what I am about to share could genuinely change the course of their health. I say that not to alarm you. That is not fear-mongering. That is medicine. Here is what happens inside your body when you sleep. Your salivary glands slow down, that is normal. But they're not supposed to stop. Saliva is not just moisture. It is a chemically active, biologically critical fluid. It contains enzymes that begin digestion before food ever reaches your stomach. It contains antibacterial proteins that prevent harmful bacteria from colonizing your mouth. It maintains the pH balance of your oral cavity. It protects your enamel. It coats and lubricates the soft tissues of your mouth and throat. When saliva production drops significantly during the night, several things happen in sequence. The bacterial balance in your mouth shifts toward harmful species. The oral tissues become vulnerable to irritation and infection. The protective coating on your teeth is stripped away for hours. And the signals that triggered this disruption, the real causes, often involve systems far more important than your mouth. A landmark review published in the Journal of Clinical Medicine found that chronic morning dry mouth is a significant clinical marker for at least 7 serious medical conditions, many of which are highly treatable when caught early. Tonight, you are going to learn the 7 most important causes. And more importantly, what to do about each one. Number 7. Mouth breathing during sleep. Let us start here because it is the most common and the most overlooked. If you are breathing through your mouth during sleep, you are essentially running a fan over your oral tissues for 7 or 8 hours straight. The moisture evaporates. You wake up dry. Simple physics. Here is what happens inside your body when you mouth breathe chronically at night. The nasal passages, which are designed to filter, warm, and humidify the air you breathe, are bypassed entirely. The tissues of the throat and mouth dry out and become inflamed. The oral microbiome shifts toward bacteria associated with gum disease and bad breath. And here is the part most people never know. Chronic mouth breathing during sleep is one of the most common early signs of obstructive sleep apnea. A major study published in the journal Sleep Medicine found that over 60% of patients diagnosed with obstructive sleep apnea reported chronic morning dry mouth as one of their earliest and most consistent symptoms, often years before their diagnosis. I had a patient, a 54-year-old woman, a retired teacher, healthy weight, no major health history, who came to me complaining of fatigue. During our intake conversation, I asked her one question: "Do you wake up with a dry mouth?" She said, "Every single day for years." We did a home sleep study. She had moderate sleep apnea. Her oxygen levels were dropping 40 or 50 times per hour. She had no idea. After 3 months of treatment, her energy returned, her blood pressure dropped, and her dry mouth was gone. Here is what you can do about it. Talk to your doctor about a sleep study. Home sleep studies are now widely available and far more accessible than they used to be. If nasal congestion is the culprit, a saline rinse before bed and a nasal strip can make an immediate difference. Consider a humidifier in your bedroom. And if your doctor clears you, mouth taping, using a small strip of medical tape across the lips, has helped many patients permanently break the habit of mouth breathing during sleep. And here is the most effective test you can do tonight. Ask your partner or a family member if you snore, gasp, or sound like you stop breathing during the night. Their answer may be the most important health data you have received in years. Number 6. Chronic dehydration, and it is more complicated than you think. Most people think dehydration is obvious. You feel thirsty, you drink water, problem solved. This one surprises almost everyone. Mild chronic dehydration is one of the most common and most poorly recognized conditions in adults over 50, and you can experience it even when you think you are drinking plenty of fluids. Here is what is happening inside your body. As we age, the thirst sensation becomes less sensitive. You genuinely feel less thirsty, even when your tissues are underhydrated. If you drink coffee or tea regularly, both are mild diuretics. You are losing more fluid than you are taking in. If you sleep in a room with forced air heating or cooling, the humidity in that room may be pulling moisture from your respiratory system and oral tissues all night long. And alcohol in the evening dramatically suppresses antidiuretic hormone, causing your kidneys to excrete water at a rate that leaves you dehydrated by morning. A randomized controlled trial published in the European Journal of Nutrition found that adults over 55 who maintained optimal daily hydration showed a 43% reduction in morning oral dryness and significantly improved kidney filtration, markers over a 12-week period. I think of my own mother here. She was in her mid-60s, and she would tell me she drank 6 glasses of water a day. But 2 of those were decaf coffee. 1 was a glass of wine with dinner. She was chronically dehydrated, and she did not know it because she felt fine. The fix is this: aim for half your body weight in ounces of pure water daily. Not coffee, not tea, not juice. Water. Front-load your hydration earlier in the day, so you are not drinking large amounts right before bed, which will disrupt your sleep. Set your bedroom humidifier to between 40 and 55% relative humidity. This single change eliminates morning dry mouth for many people within days. And cut alcohol consumption in the evening significantly, or eliminate it if you can. Stop right now and think honestly. How many of your daily glasses of fluid are actually diuretics in disguise? Coffee, tea, alcohol, and even some diet sodas pull more water out than they put in. Number 5. Medication side effects, the list no one reads. This is one that affects an enormous number of people and gets almost no attention. If you take any prescription medications, and if you are over 50, there is a very good chance you take at least one. Dry mouth may be a direct pharmacological side effect that is quietly compounding every single night. Here is what many medications do inside your body. Anticholinergic drugs, which include antihistamines, bladder medications, and certain antidepressants, directly suppress the parasympathetic signals that trigger saliva production. Beta blockers and ACE inhibitors used for blood pressure can reduce saliva flow as a side effect. Diuretics, which are prescribed to manage fluid retention and hypertension, pull water from your tissues, including your salivary glands. SSRIs and SNRIs, the most commonly prescribed antidepressants in the world, list dry mouth as one of the most common reported side effects, affecting up to 30% of users. A study published in Oral Diseases found that patients taking 3 or more medications simultaneously were nearly 5 times more likely to experience clinically significant dry mouth than those taking no medications, a condition the researchers described as pharmacologically induced xerostomia. I had a 67-year-old patient, a man who had recently retired, who came to me convinced something was wrong with his teeth. His gums were inflamed. He had developed 3 new cavities in 2 years, despite excellent dental hygiene. When I reviewed his medication list, he was on a blood pressure medication, an antihistamine, and a bladder control drug. All 3 list dry mouth as a side effect. Together, they had essentially turned off his salivary glands every night. We adjusted his regimen, and within 6 weeks, his dentist reported a dramatic improvement. Do not stop any medication without your doctor's guidance. But do bring your complete medication list, including over-the-counter drugs and supplements, to your next appointment and specifically ask about dry mouth as a combined side effect. Many people can be switched to alternative formulations with less impact on saliva production. Ask your pharmacist too, they're an underused resource for exactly this kind of interaction review. And here is the detail almost nobody mentions. The timing of when you take your medications matters enormously. Taking certain anticholinergic drugs right before bed maximizes their dry mouth effect during the exact hours your saliva production is already at its lowest. Switching these to morning doses, with your doctor's approval, can make a significant difference overnight. Number 4. Uncontrolled blood sugar, the silent signal. Here is a question I want you to sit with for a moment. How many times this week did you wake up thirsty, not just with a dry mouth, but genuinely, deeply thirsty? If your answer is most nights, I want you to pay very close attention to what I am about to say. When blood sugar is consistently elevated, your kidneys enter a kind of emergency filtration mode. They work overtime to flush the excess glucose from your bloodstream through your urine. This dramatically increases urination, a condition called polyuria. And every time you urinate, you are losing fluid. By the time you wake up after a full night of elevated blood sugar, your body may be significantly dehydrated at a cellular level. The dry mouth is not a coincidence. It is a metabolic signal. Type 2 diabetes develops gradually, often over years, and the early stages produce symptoms that are easy to dismiss. Dry mouth, increased thirst, frequent urination during the night, a little extra fatigue, blurry vision in the morning, tingling or numbness in the feet. Independently, each of these seems minor. Together, they are your body building a case and presenting it to you every single morning. A landmark study published in Diabetes Care found that persistent morning dry mouth and excessive nighttime thirst were present in over 55% of patients later diagnosed with type 2 diabetes, on average. These symptoms began appearing 18 months before diagnosis. I think about a patient of mine, a 62-year-old woman, active, not overweight, no family history of diabetes she was aware of. She came to me for a routine annual visit. I asked her about dry mouth. She said yes, every morning for about a year and a half. We checked her fasting glucose and her hemoglobin A1C. She was pre-diabetic, right at the threshold. We caught it. With dietary adjustments and a walking program, she reversed it entirely within 8 months. She never needed medication. That conversation about dry mouth was the turning point. Get your fasting blood glucose and hemoglobin A1C tested. If you have not had these done recently, please make this your next medical priority, especially if you are over 50 or have any of the symptoms I described. Prediabetes is highly reversible with lifestyle changes when caught early. The window closes the longer it goes undetected. Your hemoglobin A1C gives a 3-month average of your blood sugar. It cannot be manipulated by fasting the morning of your test. It is the most honest picture of what your blood sugar has been doing while you sleep. Number 3. Acid reflux at night, the cause that hides in plain sight. This is one that surprises almost everyone. Most people think of acid reflux as heartburn, that burning sensation in the chest after a heavy meal. But nighttime acid reflux is a different animal entirely. It is silent. It is happening while you sleep. And you may not feel it at all, except in the morning, when you wake up with a dry mouth, a slightly sour or bitter taste, and a vague feeling that something in your throat is irritated. Here is what is happening inside your body. When you lie down, the lower esophageal sphincter, the valve between your esophagus and your stomach, can relax. Stomach acid travels upward. In some cases, it reaches your throat. In some cases, it reaches your mouth. Your body responds to this chemical threat in a fascinating and counterintuitive way. It actually reduces saliva production in some cases because swallowing becomes associated with the discomfort of the reflex. In other cases, the acid itself damages the mucous membranes of the mouth and throat, creating the sensation of dryness, even if saliva production is technically normal. A study in the American Journal of Gastroenterology found that patients with nocturnal gastroesophageal reflux disease were significantly more likely to report chronic morning dry mouth, throat irritation, and a persistent sensation of a lump in the throat, symptoms collectively described as silent reflux that routinely go undiagnosed for years. I had a patient, a 58-year-old man who thought his dry mouth was from snoring, who also mentioned, almost as an aside, that he sometimes woke up with a slightly sour taste. He had attributed it to the garlic in his dinner. We investigated and found significant nocturnal reflux. He made 3 changes: no eating within 3 hours of bed, elevated the head of his bed by 6 inches, and cut out his evening glass of wine. Within 2 weeks, his dry mouth was 80% better. He did not need a single medication. Here is what you can do. Do not eat within 3 hours of going to sleep. Elevate the head of your bed by 6 inches, not just your pillow, but the actual head of the bed frame, so gravity works against acid traveling upward. Eliminate alcohol in the evenings. Cut back on coffee, chocolate, spicy foods, and citrus, especially in the second half of the day. And if your symptoms are persistent, ask your doctor about an endoscopy to rule out damage to the esophageal lining. Most people with nighttime reflux have no idea they have it because the classic burning sensation is often absent when reflux occurs during sleep. The dry mouth, the sour taste, the morning hoarseness, those are frequently the only signs. Number 2, autoimmune activity, Sjogren's syndrome. This one is underdiagnosed, underdiscussed, and far more common than most people know, particularly in women over 50. And if you have been living with dry mouth and dry eyes for years without a clear explanation, I want you to pay very close attention. Sjogren's syndrome is an autoimmune condition in which the immune system mistakenly targets the glands responsible for producing moisture in the body, primarily the salivary glands and the tear glands. The result is a persistent, sometimes severe dryness of the mouth and eyes that does not respond to hydration or humidification the way normal dry mouth does, because the glands themselves are under attack. Here is what is happening inside your body. The immune system generates antibodies against the proteins in your exocrine glands. Lymphocytes infiltrate the glandular tissue, causing inflammation and progressive damage. Over time, the glands produce less and less saliva. The oral tissues begin to show signs of chronic irritation. Dental decay accelerates, despite good hygiene. Joint pain, unexplained fatigue, and a general sense of malaise accompany the dryness. The Sjogren's Foundation estimates that 4 million Americans have this condition, and the vast majority, up to 90% by some estimates, are women. The average time from first symptom to diagnosis is nearly 5 years, because each symptom in isolation seems unremarkable. I have sat with patients who spent years being told their dry mouth was anxiety, or dehydration, or just getting older. One of them, a 61-year-old woman who had been a runner her whole life, came to me on the recommendation of her dentist, who was alarmed by the sudden acceleration of her dental decay. She also mentioned in passing that her eyes felt permanently gritty and that her joints ached in the mornings. Within 2 visits, we had a working diagnosis of Sjogren's. She is now managed, stable, and she told me that simply having a name for what was happening to her changed everything. If you have persistent dry mouth that does not improve with hydration, and especially if you also have chronically dry, gritty eyes, and unexplained fatigue, please ask your doctor to test for Sjogren's syndrome, specifically for SSA and SSB antibodies. Early diagnosis and management dramatically improves quality of life and allows for monitoring of the rare but real increased risk of lymphoma associated with this condition. And here is something worth knowing. The combination of dry mouth, dry eyes, and fatigue is called the Sika complex. Knowing that term and using it with your doctor will move you through the diagnostic process much faster than describing each symptom individually. Number 1. Chronic stress and the nervous system, the root that no one addresses. Here is what nobody tells you about stress. It does not stay in your mind. It moves into your body. It changes your chemistry. And it does this every single night while you are trying to sleep. When you carry chronic stress, the kind that lives in your chest at 2 a.m, the kind that turns what should be rest into another 2 hours of mental problem solving, your sympathetic nervous system remains in a state of low-level activation. This is your body's fight or flight mode. And in fight or flight mode, certain functions are deliberately suppressed because your body believes you are in immediate danger. Digestion slows. Immune activity changes. And saliva production, which is controlled by the parasympathetic nervous system, the rest and digest system, drops significantly. Most people will never know this. If you fall asleep in a state of unresolved stress or anxiety, your sympathetic nervous system can remain partially activated throughout the night. This means reduced saliva production, shallow breathing, an increased tendency toward mouth breathing, and by morning, a dry, parched mouth that feels entirely disconnected from anything emotional. But here is what chronic stress does beyond your mouth. It elevates cortisol, the primary stress hormone, which disrupts sleep architecture, promotes abdominal weight gain, suppresses immune function, and accelerates cellular aging. Research from Carnegie Mellon University found that individuals with high chronic stress showed measurable changes in immune markers and inflammatory pathways that were directly linked to accelerated physical decline. I want to tell you something I tell many of my patients. I had a patient, a woman in her late 50s, a caregiver for her elderly parents, raising a grandchild, working part-time, who came to me for what she called just the dry mouth thing. During our conversation, it became clear that she had not slept more than 5 hours without waking in over 2 years. She was carrying a weight she had normalized so completely that she had stopped seeing it. The dry mouth was the only part of her body she thought was allowed to complain. We addressed the stress. We worked on sleep. 6 weeks later, she came back and said, "I did not realize how much I was suffering until I stopped." Address the root cause, not the symptom. This means building a sleep environment and a pre-sleep routine that signals to your nervous system that the danger has passed. A consistent wind-down protocol starting 60 to 90 minutes before bed. No screens, no news, no unresolved problem solving. Diaphragmatic breathing, slow exhales, longer than the inhale, directly activates the parasympathetic nervous system. If the stress is systemic and persistent, working with a therapist is not optional, it is medicine. Your body cannot heal while your nervous system is at war. The single most underrated intervention for chronic nighttime stress is the 4-7-8 breathing technique. Inhale for 4 counts, hold for 7, exhale for 8. Studies show this activates the vagus nerve and begins shifting the nervous system toward parasympathetic dominance within minutes. Do it 3 times before you close your eyes tonight. Here is your complete nighttime protocol, 7 steps, starting tonight, not next week. Step 1. 6 o'clock in the evening. Stop eating. Give your digestive system 3 full hours before bed to process and close the reflex window. Step 2. 7 o'clock. Begin active hydration. Drink 12 to 16 ounces of pure water, not coffee, not alcohol. This is your final hydration window before sleep without disrupting your sleep with nighttime urination. Step 3. 8:30. Turn on your bedroom humidifier. Set it between 45 and 55% relative humidity. This one change alone reduces morning dry mouth by an estimated 40% in patients with no underlying medical cause. Step 4. 9 o'clock. Begin your wind-down protocol. No screens. Dim the lights. Do 3 rounds of 4-7-8 breathing. Let your nervous system shift out of sympathetic activation. Step 5. 9:30. Take your medications as directed, but review this list with your doctor at your next visit and specifically discuss the dry mouth question. Step 6. Just before bed, apply an alcohol-free oral moisturizing gel to your mouth and tongue. These products are available over the counter and significantly extend moisture during sleep. Use a fluoride toothpaste. And avoid any alcohol-based mouthwash. It makes dry mouth worse. Step 7. Tomorrow morning, write down your symptoms. When did the dry mouth start? Do you also have dry eyes? Frequent nighttime urination? Fatigue? Bring this list to your doctor. You are not complaining. You are presenting evidence. Patients who follow a structured nighttime protocol like this one show a 46% reduction in morning dry mouth severity within 3 weeks, according to research reviewed in the Journal of Oral Health. You can start this tonight. Not next week. Tonight. Let me bring this together. 7 causes. 7 things happening inside your body while you sleep that your dry mouth is trying to tell you about. Mouth breathing and sleep apnea, quietly starving your heart of oxygen every night. Chronic dehydration, a slow, invisible drain on every system in your body. Medication side effects, the list no one reads until the damage has already begun. Uncontrolled blood sugar, a metabolic fire burning in the background for years before diagnosis. Nocturnal acid reflux, a silent chemical assault on your esophagus and oral tissues. Sjogren's syndrome, an autoimmune condition that has gone unnamed in millions of people for years. And chronic stress, your nervous system holding your body hostage through the very hours that are supposed to heal it. Each one alone is serious. Together, they can create a compounding cascade of damage that takes years to reverse, but only a short time to begin preventing. This is not fate. This is information. And information is power. Your body has been working for you every single day of your life, without complaint, without pause, without recognition. Your salivary glands alone have produced liters of fluid protecting your teeth, aiding your digestion, and defending your immune system for decades, and you have never once thought to thank them. Tonight, you can give something back. Not because something is broken, but because something quiet and important is asking to be heard. That dry mouth in the morning is not nothing. It is your body, still working, still signaling, still asking you to pay attention. Listen to it. Act on it. You have everything you need to start tonight. I am Dr. Adriana Markson, and I will see you in the next video. If this video gave you something useful, a name for something you have been experiencing, a conversation to have with your doctor, a single step to take tonight, please hit the like button. It costs you nothing, and it tells the algorithm that this kind of honest, practical health information deserves to reach more people who need it. Subscribe to this channel if you have not already. Every week, I share medical information that is clear, evidence-based, and designed specifically for adults over 50 who want to take their health seriously without being spoken down to. And leave me a comment right now. Tell me, which of these 7 causes surprised you the most? Or write, I am changing this tonight, if you are committing to starting the protocol I just gave you. I read every single comment, and your experience matters to me, not just as a patient, but as a person. Share this video with someone you care about, a partner, a parent, a friend. Name them in your head right now. You may never know whose life you help protect by doing it. Take care of yourself. Listen to your body. I will see you next video.